Daniel's a tough act to follow. That was a fun and quick tour through all the technology that we're going to see in the future. One of the things we're going to do on this panel is to talk about how far, how fast. And this is a bit of a corollary to the panel that Steve led earlier around the consumerization of healthcare. In a way, focused, and that panel was very focused on price and incentives. And what we'll do in this panel is just focus on everything else. So here we go. So as we thought about putting together this panel, the first thing we did was ask, so consumers, and when we think about consumerizing technology, we often think about Apple, of course. And so we said, well, who could we get that has an insight into how Apple was run and also is passionate and engaged in healthcare? And unfortunately, the best we could do is the former CEO for the pivot to consumerism at Apple, and now an engaged healthcare investor. So we have John Sculley. And next to my immediate left, Marty Felsenthal is a partner with HLM Ventures. And Marty has been an investor in health services and health technology for 15 years and recently turned his attention to consumers. He's also a longtime patient and entrepreneur, and he may speak to that a little bit. And my far left, Roberto Tapia-Conyer, is Director General of the Carlos Slim Institute, a non-for-profit which focuses on a different segment in a different country. And so as we talk about consumers, we thought it would be interesting to try to bring a very different perspective into the conversation. So I'd like to begin, if I may, John, with you, in a simple question. After a very successful run in consumer goods and then technology, why healthcare?
Well, the perspective I had, Ted, is that when I was recruited to Silicon Valley back in 1982 by Steve Jobs, Silicon Valley was totally a domain of technology. And the idea that somebody would come without a technology background as a consumer marketer seemed a little bit bizarre. But Steve Jobs was convinced that the future of personal computers at that time was that these would become consumer appliances, and therefore they should be marketed much the way that big brands like Pepsi and Coke are marketed. Well, now we're 30 years later, and I think that we're at a point where healthcare industry, which is a domain that we don't normally think of big brand consumer marketing, is ready for big brand consumer behavior change, engagement with consumers, getting consumers to take advantage of many of the kinds of technologies which Daniel Kraft just gave us a great review of. So the timing's right.
Terrific. And Marty, after investing for a number of years in health services, you turned your attention recently to consumers. Why consumers now?
You know, I think, Ted, there are really two compelling reasons for that. One is that, you know, our clinician shortages in this country have been getting worse and worse because of an aging population of patients coupled with an aging population of clinicians. And as those shortages have gotten worse, we've seen a real trend towards consumers, not patients, increasingly reach into their own pockets to pay for either better access to healthcare or better perceived quality of healthcare. And I say perceived quality rather than quality because I think it's very challenging for us as consumers to really figure out what's good quality healthcare and what's not good quality healthcare. The second big reason that we've been increasingly focused on consumerism in healthcare is, of course, related to healthcare reform. And our, just by way of background, a significant portion of our capital at HLM comes from strategic limited partners. 5 of the largest health plans in the country, 3 very large hospitals, and a large pharmacy chain. And, you know, as their business post-reform shifts from B to B, 90% of insurance, commercial insurance bought by employers for their employees, to what many think will be 50-50 post-reform, you know, we as consumers are going to be spending a lot more discretionary income on insurance and on provider services.
And Roberto, you bring, as I mentioned, I think a different perspective here. Could you talk a little bit about what you do at the Carlos Slim Institute and the kinds of solutions you're working to develop?
Well, yes. Since 6 years ago, the Institute was created mostly with the interest of, as a nonprofit organization, to really look at innovation and even generate innovation in a way that it can provide the national health system based on the latest health reform that we had that provided 100% coverage through public insurance to the entire Mexican population. So how could we provide let's say, the most advanced and how to make the system to be more efficient? Once you had the coverage of health services, now you had to provide innovation as a way to ensure two things: that people really got into the service in the highest quality. And then technology was one of the, I would say, platforms that we explored together with research and other issues, which is not the topic at this moment, but we really put our investment in developing innovation that it was very hard for government to do or for even private organizations to do in terms of not looking at a profit behind the investment. So that's the purpose of it. And we really wanted to make sure that the innovation was going to also change the paradigm of health services, which is really not to maintain let's say, the model that you went to the physician or to the health service and then you got an appointment to see how you were doing a week or 10 days later. But you can move from that position to a continuous of care. Second, to reach out to the community or even to the household, and not only within the health unit. Mm-hmm. And third, to generate more compliance, looking also at the problem that we have as it's happening in any part of the world. It's in non-communicable diseases, diabetes, hypertension. So we needed to really make sure that we're going to also have a more corresponding, a patient empowered, but at the same time linked in a more responsible way to the health system. So that's why we really devoted a lot of our efforts this 6 years to come up with innovation using the platform as the technology platform as our basis.
A number of your innovations are in an area that I think apply across the panel. That must be important in telemedicine. So actually, I'd like to. This is one question where I'd actually like to hear from each of you about what you're doing, in particular eye towards how far, how fast in telemedicine. John, you want to kick it off?
Okay, sure. I think telemedicine is something which is going to happen now. It couldn't have happened even 2 or 3 years ago because the technologies weren't ready and the problem wasn't as obvious that it needed to be solved. If you're going to build a big branded business, and I think that telemedicine will be a big branded business. There are 3 companies really out there now, Teledoc, MD Live, American Well. The market's more than big enough for those 3 to become really multi-billion-dollar businesses, I think, over time. The reason why I say that is that if you look at our system, as Steve Forbes said earlier today, our healthcare system is employer-based, and we're now moving to self-insured employers. We think the tipping point of when we get over 50% of employers being self-insured, there's about 100 million workers, is around 2016. The employers are going to catastrophic insurance with high deductibles. That means that their employees aren't going to have the co-pays that they were used to before, and at least for the first several $1,000s each year. And that opens up the opportunities for new kinds of health services. I think the real innovation is going to be in the delivery of healthcare services. A good indicator of why I think telemedicine is going to be big is that if we look at walk-in urgent care, which a decade ago didn't exist, there are 9,000 walk-in urgent care centers, and we did a survey this summer, and we're astounded to see that 24% of the population, it's a large sample, had been to a walk-in urgent care center twice in the last 12 months. Now, 24% is about what the iPad adoption is. So that's a big number. And if we look at the fact that people are paying for services at walk-in urgent care, it's an alternative to emergency departments, we think telemedicine is the same kind of a story where you can have disruptive pricing, you can have services where people don't have to go to the doctor's office and have a face-to-face visit, and actually for many low acuity care type procedures, it's a very good solution. So the technology's ready, the market is ready, and there are several companies that are taking advantage of that right now.
Yeah. Marty, as a Teledoc investor, would you agree that there are 3 companies in this space?
Well, actually, I mean, interestingly enough, I actually think telemedicine is less about the technology today, and it's much more about the reimbursement and the impetus to buy. And we're investors in Teledoc, which is a telemedicine solution like MD Live Care that serves non-urgent primary care needs. We were also investors in a business called Aperio that makes digital pathology solutions, that takes an anatomic pathology slide and allows an oncologist to send a potential cancer biopsy to any pathologist in the world. And so I think there are multiple segments of telemedicine. We're very bullish on the sector, but the sectors that we are most interested in are those where there's either third-party reimbursement in place, there is a compelling economic reason on the part of the hospital or the nursing home to pick up these costs on their own because it'll help them save operating costs, or in the case of an MD Live Care or a Teledoc, consumers are willing to reach into their own pockets. And interestingly enough, and you and I talked about this last night, Ted, I think there is an element of the MD Live Cares and the Teledocs that is actually a lot more consumer-based than clinically based. These are minor, non-urgent needs.
Yeah.
Yeah, and I would say that Teledoc's been very successful starting out with employers, and that's its primary focus, as I understand it. We're also interested in the consumer side, so we're developing a direct-to-consumer version of the service as well as the employer-based service.
Well, we're not really into the telemedicine part. We call it more the telemetrics, because what we're really is innovation that can be linked maybe to a computer, not necessarily a physician, not necessarily a nurse, but and let me give an example. If you have a person living with diabetes at home and you want to know their levels of glucose and their metrics, and you can have a pattern of that, you don't need another human being on the other side of the system. You can have the system work as a monitoring process that can provide. So if you're looking at low cost and sustainability around a system like it's in Mexico, then we had to consider that it can be a 24-hour, and at the same time it can be low cost. So it's more like sending the information that your body can generate or that you can put into your cellular phone at some point, or through Bluetooth be connected to that, and then you can have the response. And you can have an alarm system if you need that. But so that's the model that we're playing. So yes, and I think it's going to be, it's going to have a rapid expansion for that.